Hello, friends. Welcome back. This is Dr. Becky of Dr. Becky's Better Brain Tips, and I'm here with the second part of the video that's kind of critiquing and breaking down Dr. Sanjay Gupta's special on CNN that was called The Last Alzheimer's Patient. And in the first video, which I'll have linked, I talked a lot about the clinical trial that the Alzheimer's Association had just finished with a drug that was called solanezumab. It was a 240-week study, so about a 5-year study. And in that first video, you can hear all about that. But in today's video, what I want to talk about is I want to give you 3 distinct different lifestyle strategies that you can start using right now to improve the health of your brain, to allow you to make a neurochemical that's called brain-derived neurotrophic factor, also called BDNF. And BDNF is a neurochemical that's responsible for growing brand new brain cells. So when you have the material necessary, you yourself can actually grow brand new brain cells, which is wonderful, inspiring, and encouraging, and it just lets you know that if you do the right things, then you can at least not be as concerned as I initially was about what could happen to the health of my brain. So the first lifestyle strategy I want to talk about, and again, just give you a small little window of things you can do, and that's related to nutrition. And again, that's no surprise, right? Eating healthy and exercise, and we've all heard that since we were very small children. Eat right and exercise. So I'm going to just talk to you today about 3 foods that I hope you can put in your normal routine. 2 of the foods are foods that I eat every single solitary day, and the third food is a food that I do eat 3 times a week, at least. So the 2 foods that I eat every single day, because they are clinically shown to help improve the production of BDNF, and they do many other things to support the health of the brain, but those foods are blueberries and walnuts. Every day, I eat blueberries and walnuts because I want to support the health of my brain. It's easy enough to do. You can do it too. Well, how much blueberries should I eat? Well, if you can eat about a half a cup, so again, it's not a huge amount, a half a cup of fresh or frozen blueberries every day. And for me, for walnuts, I just get a palmful. So I just, pour some in till it fills up my palm. That's the amount that I eat of walnuts every day. And then the third food that I eat at least 3 times a week is fish. And I prefer the fatty fish. So they're going to be the fish, salmon, tuna, herring, sardine. The fish that are fatty are the fish that have those omega-3 fatty acids. And again, time and time, we've seen the studies that show how consuming high levels of omega-3s can support the health of your brain. And walnuts also have omega-3 fatty acids. So you get a win-win with eating your walnuts. So you can do this easy, right? Blueberries, walnuts, fish. You can do that. Simple little thing. You've checked off one step that you can do to improve the health of your brain. The second thing that you can do to improve the health of your brain is to do some physical exercise. And I'm going to have a link for you that's going to show you a trial that was done. It was a 12-week trial. And in this 12-week trial, all of the participants were between 60 and 80 years old. So don't tell me, it's too late for me. I'm already old. I can't start. If you're still alive, and you're less than 80 years old, you can start this exercise protocol. What they did for 12 weeks, and they took imaging of a brain and blood before, during, and after. And they looked at BDNF production, and they also looked at the health of the brain. And at the end of 12 weeks, they saw more BDNF production. So again, when you make more BDNF, that means you have the ability to make more brain cells. And so what was the physical exercise that was done in this study? In this study, again, the people were exercising only 2 or 3 days a week. And in this study, they only did leg exercises. So they only used one body part, but the leg exercises they did, and this was in a gym, but there's other ways that you can work your legs. But in this study, they did the leg presses, and you've all seen the machine at the gym to do the leg presses, plus then the leg extensions where you've got the weights and you lift your legs up, or leg flexion, again, where you have the weights behind you and you push your legs in up against weights. So this study, 2 or 3 days a week, the participants were 60 to 80 years old. They did legs, and it allowed the brain to make that neurochemical BDNF, and having more of that BDNF then allowed them to make brand new brain cells, and they could fill in some of the holes that were starting to show up in the brain. So, number 2, exercise. Legs. You should do weight training on everything. So arms, do some weight training on your arms, weight training on your legs, but do weight training. I know it seems odd. Well, how does doing physical exercise help my brain? But now you know, when you do resistance training, when you do weight training, it helps you to make that neurochemical BDNF so you can make new brain cells. The third thing I want you to do is I want you to think about maybe using some key supplements. And these aren't like weird, far out supplements, but there's a lot of great information. 2 supplements in particular that might be of benefit for you, and they might not. But magnesium is a mineral that about 80 to 85% of the American population is deficient in. That's a lot. Magnesium plays a key role in the health of your brain. Now, how can I get magnesium in my foods? Well, I can eat lots of green leafy vegetables or a palm full of raw pumpkin seeds. So pumpkin seeds, a great source of magnesium. Your green leafy vegetables, another great source of magnesium. But for some people, they still don't have adequate magnesium. And so if that's the case, then taking a good quality magnesium supplement could be beneficial for you. And I will have in the link the magnesium that my husband and I have taken for well over 15 years. I saw the clinical studies about 15 years ago about the importance of magnesium for brain health and cardiac health. And so that's when we both started taking magnesium, and we've taken it every single solitary day since. So again, last 15 years. So I'll have a link for the type of magnesium that my husband and I use. But one thing I do want you to know, because you can get a magnesium supplement anywhere. You can go to Walgreens, you can go to CVS, you can go to Walmart, and you can go to any good quality health food store. But if you're at the Walgreens, the CVS, likely the magnesium you'll see there when you pick up the bottle and you turn the label over and you read the back, it will tell you that the form of magnesium is called magnesium oxide. If it's magnesium oxide all by itself, do not buy it. Magnesium oxide is good for one thing, and that is to cause you to have loose stools. So if you're constipated and you need to go, then magnesium oxide is going to help to soften your stools so that you can have a bowel movement. But if you don't have that problem and you're taking magnesium, hey, Dr. Beck told me to take magnesium, and you're taking mag oxide, you're just going to be running to the bathroom, pooing your brains out, and you're going to be mad at me. So don't buy cheap magnesium oxide. Now, there are lots of companies, and what my husband and I use is a wide array of different magnesiums. So if magnesium oxide is in a combo, but you see it also has magnesium glycinate, magnesium malate, magnesium citrate. You see all sorts of different forms of magnesium, and magnesium oxide is mixed in with that. That's A-okay. But do not just take magnesium oxide all by itself, because all it's going to do is soften your stools, but it won't give you the brain support that you're hoping for. The second nutrient that I want you to consider, but again, I want you to have the test first to find out where your numbers are, and that's vitamin D. We also know, I told you about 80 to 85% of Americans are deficient in magnesium. 85% of Americans are definitely deficient in vitamin D. And oftentimes people think about vitamin D as a nutrient that makes your bones strong, and it does do that. But vitamin D does so much more than that. Vitamin D is crucial for cardiac function. vitamin D is crucial for brain health. And vitamin D, where it really shines, is in the realm of immune function. And we got to see that on full display in 2020 when the entire world was covered in a pandemic, because virtually every single person that had passed away from COVID back when the pandemic first started had been deficient in vitamin D. And so it's easy enough to know you can, and virtually all insurance companies will cover the blood test. So you can just go to your doctor and say, I want a blood test. I want to see what my vitamin D level is. But if you don't want to go to your doctor to get the blood test, you can just type online vitamin D test kit. And there are labs that will just mail a test kit to you. And then they have a little lancet that you can just prick your finger, squeeze a few drops of blood on a little card, mail that back to the lab, and they'll tell you what your numbers are. Now, depending on the labs, AMA, so American Medical Association, AMA guidelines say we want your blood vitamin D level to be somewhere between a 20 and a 30. And it will say, oh, so, some labs, if it's 20, and if your number comes back and it says 22, 23, sometimes your doctor will say, hey, you're within normal limits, nothing to worry about. Well, I'm here to tell you, if your number is, let's say if the lab value is a 20 and you're at a 21 or a 22, that means you've got exactly enough vitamin D to prevent rickets, and that's in the bone-destroying disease. But you don't have any extra D that's going to help your heart, that's going to help your brain, that's going to help your immune system. Most people need their vitamin D levels to be hanging out somewhere between a 40 and a 50 to make sure that you've got enough vitamin D to cover all the things that you need it to do in your body. So again, test, don't guess, but if you do the test and you know that your vitamin D levels are not between a 40 and a 50, then likely you will need to supplement to get your numbers up there. So those are, again, so 3 things we've talked about. 3 foods you can eat more of. We've talked about specific exercises you can do. And we've talked about 2 key nutrients. And if you just do those few little things, you don't do anything else. Let's say you're not interested in learning more about, well, what are more lifestyle things I can do? If you could just do those 3 things, you're at least setting yourself up to help your brain make more brain cells, and that's what I want for you. Please share this information with any loved one that you have, especially those that you know care about the health of their brain, whether or not they're starting to see signs or symptoms, or whether they're people like me that just want to be proactive and say, I don't ever want anything to go wrong with my brain, so I want to do all the right things now to keep my brain as healthy as I can for as long as I can. And as I mentioned in the first video, and I'll mention it here, I'll have in the description box, I have a free eating plan. This eating plan is robust with all of the foods that help to support optimal brain health. So if you think, I don't even know where to start, again, there will be a link that you can go straight to my website and you can look at you can download for free a meal plan that will put you on the path to eating more of the foods that will support optimal health. So thank you so much for tuning in. I pray that this information has been a blessing to you, and I look forward to seeing you the next time. Take care. Bye now.